Chairwoman Higgins, Ranking Member Ramirez, and members of the subcommittee, thank you for the opportunity to be here today to discuss VA's progress implementing requirements in the Elizabeth Dole Act. The Dole Act authorized significant expansions to healthcare programs and support for veterans. Today, I would like to highlight GAO's work in two areas that are addressed in the law: the Veterans Community Care Program and the Caregiver Support Program. First, the Dole Act contains a number of provisions for VA that are intended to improve the agency's healthcare operations, including community care. Relatedly, GAO has a long history of reviewing the community care program, including some of the more recent changes to how referrals are processed and appointments are scheduled. In a little more than 10 years, the community care program has tripled in size and represents nearly 42% of all VA healthcare appointments. With that expansion, the administrative processes at VA facilities have become more complex and continue to be labor-intensive. Through this growth, the Veterans Health Administration has made numerous changes to how the program is administered in order to gain efficiencies and ensure that veterans understand their healthcare options. In 2020, we issued a report on VA's implementation of the Veterans Community Care Program. In that review, we described the timeliness of processing referrals and scheduling appointments. We made 3 recommendations to VA in that report, 2 that remain open, including that VHA assess the staffing and resource needed to process community care referrals and schedule appointments. We also recommended the agency set standards for monitoring the appointment scheduling process, including the receipt of care with a community care provider. We also issued 2 reports in 2025 addressing 2 key VHA efforts: the establishment of the VHA's Integrated Veteran Care Office, or IVC, and the implementation of the Referral Coordination Initiative. The creation of the IVC was an organizational forum to address VHA's progressively complex processes to manage healthcare delivery at facilities and through the community care program. It consolidated the management of VA healthcare delivered in the facilities and through community care with the intent of improving coordination and ensuring veterans receive seamless access to care. The Referral Coordination Initiative was created to ensure veterans understood their care options and to also create efficiencies for facilities in processing referrals and scheduling appointments. In both reports, we highlight deficiencies in the implementation of these efforts that ultimately can impact veterans' access to care. Recommendations from both of those reviews remain open. As VHA prepares to go through additional changes, including restructuring and the next generation of community care contracts, it is critical that the agency ensure it has the effective management structures in place to ensure veterans' timely access to care. Addressing GAO's outstanding recommendations and addressing the mandates in the Dole Act will help VA to ensure veterans receive consistent, high-quality health care. The second program that I would like to highlight is VA's Caregiver Support Program. The Caregiver Support Program plays a critical role in supporting caregivers who assist veterans who have suffered serious injuries with essential tasks of everyday living. There are currently about 98,000 caregivers participating in the program. Given the toll that daily caregiving can take on caregivers' mental health, ensuring VHA effectively spreads awareness about the mental health support it offers to caregivers is essential to ensuring that interested caregivers participate in the program and they receive the help that they need. The Dole Act includes a number of provisions to bolster the supports for caregivers caring for veterans, including a mandate for GAO to review mental health support for caregivers. Our work is ongoing. However, I will preview some preliminary findings. In our report, we describe a variety of services to support caregivers' mental health and well-being, such as individual therapy, support groups, respite care, among others. We also identified some challenges caregivers experience in accessing the services, including the limited ability to travel to receive support in person. In our report, we describe some steps VHA is taking to address these challenges, such as creating a virtual psychotherapy program for caregivers. However, our preliminary findings also show that VHA has not fully implemented performance management practices for ensuring veterans and their caregivers are aware of the program. Effective implementation of performance management practices is not just a bureaucratic exercise. Following the practice of setting program goals with targets and timeframes, collecting data to measure progress towards those goals, and in using that information to assess results and inform decisions on any adjustments to those efforts can help to ensure the program is meeting its intended results, getting caregivers the support they need. The requirements for VA in the Elizabeth Dole Act align with many of the findings and recommendations from GAO's reviews. VA's adoptions of those recommendations would aid the department's progress toward implementing the Dole Act's provisions. And that concludes my prepared statement. Thank you.